best job in the world. I'm a doctor. No, believe me, that's not why. I'm an obesity doctor. I have the honor of working with a group of people subject to the last widely accepted prejudice, being fat. These people have suffered a lot by the time they see me. Shame, guilt, blame, and outright discrimination. The attitude that many take, including those in healthcare, is that these people are to blame for their situation. If they could just control themselves, they wouldn't be overweight, and they're not motivated to change. Please let me tell you, this is not the case. The blame, if we've got to extend some here, has been with our advice, and it's time we change that. Obesity is a disease. It's not something created by lack of character. It's a hormonal disease, and there are many hormones involved, and one of the main ones is a hormone called insulin. Most obese individuals are resistant to this hormone, insulin. So what does that mean exactly, to be resistant to insulin? Well, insulin resistance is essentially a state of pre-pre type 2 diabetes. Insulin's job is to drive glucose or blood sugar into the cells where it can be used. In a nutshell, when someone is insulin resistant, they're having trouble getting blood sugar where it needs to go, into those cells. And it just can't hang out in the blood after we eat, or we would all have a diabetic crisis after every meal. So when someone is resistant to insulin, the body's response to this is to just make more of it. And insulin levels will rise, and for a while, years even, this is going to keep up, and blood sugar levels can remain normal. However, usually it can't keep up forever, and even at those elevated levels of insulin are not enough to keep blood sugar in the normal range. So it starts to rise. That's diabetes. It probably won't surprise you to hear that most of my patients have insulin resistance or diabetes. And if you're sitting there thinking, that's not me, you actually might want to think again, because almost 50% of adult Americans now have diabetes or prediabetes. That is almost 120 million of us. But that's hardly everyone who has issues with insulin, because as I was saying, people have elevated insulin levels due to insulin resistance for years, even decades before the diagnosis of even prediabetes is made. Plus, it's been shown that 16 to 25% of normal weight adults are also insulin resistant. So in case you're keeping track, this is a heck of a lot of us. So the trouble with insulin resistance is, if it goes up, we are at great risk for developing type 2 diabetes. But also, insulin